This is Dr. Kaleda with the Calaveras County Health Department with some information today about pertussis. Pertussis is also known as whooping cough, and as I'm sure you've heard in the news, cases of pertussis are happening in California at epidemic levels. So far in 2010, there have been 5 to 6 times the normal cases of pertussis that we'd expect to be seeing, and there have been 6 deaths, all in young infants. So pertussis can be a very dangerous illness and even cause death in young children. And so there's ways that I'll talk about that you can prevent pertussis, especially in those young infants. Some background information on pertussis is that it's a respiratory infection. It involves the lungs, and a person with pertussis has symptoms of cough. That cough just won't go away. It can last for more than 2 weeks. That cough's also associated with whooping. That's where people cough so hard that they have to really suck in hard to get their breath afterwards, especially if they're having fits or spasms of coughing. Sometimes a person will cough so hard they even throw up afterwards. Those symptoms of cough that's more than 2 weeks and those other associated symptoms could very well be pertussis. If you have that, let your healthcare professional, let your doctor know, and they can do testing, and there's treatment available for pertussis with taking antibiotics to make it go away. That prevents transmission of it to other people that you may have contact with in your household. The best way to prevent pertussis is through vaccination. Vaccination against pertussis can be given to young children as well as even adults and the elderly. So for young children, you can't start getting the pertussis vaccine until you're greater than 6 weeks old. So the first series of pertussis shots is given in a series of 5 immunizations. They're part of the routine childhood vaccination series that your doctor already has available. And they're given in a series of 5 shots that goes all the way from 6 weeks old up to about 5 years old, right before kindergarten. So check your child's shot record, and if they're behind in their DTaP series of vaccines, then let your doctor know and they can get you caught up. Another thing that can be done, especially in those infants less than 6 weeks old that might be too young to get their first pertussis vaccine, is for any adults who have exposure to that children to get vaccinated themselves. So people who are over 7 years old, we used to say up to 65, now that age cap's been removed. So anybody over 7 years old should get vaccinated against pertussis through the booster shot that's now available that's called Tdap. If a person is over 65, again, talk to your doctor, healthcare provider about that, about whether the vaccine's right for you. But the people who should get the pertussis booster are those who are having exposure to infants, especially those young infants, like I said, or pregnant women. So if you're thinking about getting pregnant, if you are pregnant, if you just recently had a baby, talk to your doctor about getting the booster shot for pertussis, because that's the best way to give protection to those sensitive young infants who are at higher risk of more serious complications, even death, from whooping cough. For further information about whooping cough vaccination, about the pertussis vaccine, call the health department, Calaveras County Health Department, at 754-6460, or visit our website, www.calaveraspublichealth.com. Thank you.